But I'm really pleased to be able to welcome our speaker this evening, Dr. David Cundall, who is going to speak on Leeds' response to children at risk of tuberculosis, 1898 to 1960. It's a special privilege to welcome somebody who comes from a different professional sphere, but brings to his historical interest his knowledge from his specialist sphere in medical practice. David was a paediatrician at LGI. So we look forward to what he has to say to us this evening. And given that Michael can't be with us, it gives David a little bit longer to expand on his subject. So I hand over to David. Thank you very much.
Thank you very much, Roy. It's a pleasure to be here and back at a members' evening. It's about 3 years since I was last here, and I'm undoubtedly older and possibly wiser when it comes to historical research. I will confess at the outset that I didn't actually complete my master's by research in history at the University of Leeds. Alexia Moncrief and Will Jackson, my supervisors, tried to enable this medic to understand the methods, language and style of academic historians. But enrolling for a master's gave me access to essential libraries, journals and archives. I spent many happy days at the West Yorkshire Archive Service. I believe that some of the staff may be joining us on Zoom this evening, so if you are, thank you very much. So as Roy said, I used to be a community paediatrician in Leeds, but my interest in tuberculosis started when I developed the disease as a junior doctor at St James's in 1981. This personal encounter led to a long-term research interest in TB. After I retired, I was able to start delving into the history of the preventorium at the Hollies in Wheatwood. A preventorium was a residential home and open-air school for children at risk of TB. I may be the first person to have trawled through the register of children attending the Hollies, and also the logbook. And these primary sources are at the heart of my research. Crucially, I also had the chance to interview adults who remember their time at the Hollies as children. And I also interviewed one person who remembered visiting there as a doctor, and I was put in contact with her as a result of my previous presentation to this society. So thank you very much. So we're looking at Leeds' response to children at risk of TB for 63 years, from starting in 1898. And I hope to show that, although there were pivotal medical discoveries during these 6 decades, the city's approach to children at risk of TB was strongly influenced by social and cultural forces. These 3 images on the first slide highlight core elements of the story. On the right, we've got TB bacteria, like those first isolated by Robert Koch in 1882. His meticulous work led to conclusive proof that TB was an infection, not a character type, not an inherited disease, but an infection. It's an ancient disease which had, and arguably still has, in many parts of the world, a unique cultural heft compared to most other infectious illnesses. It is insidious and adept at evading the body's defenses. The time from initial infection to symptomatic illness is often measured in years, not days or weeks. It's often a dormant infection.
Well, I think it's their end. It is there.
Which tends to reawaken and cause disease when immune systems are at a low ebb. TB meets the role description of an enemy within and often kills young adults. At the turn of the 19th to 20th century, it was responsible for 1 in 8 deaths. It was the single biggest killer of men and the second biggest killer of women. So this glamorous young woman represented someone who might die from TB. The poster was produced by the National Association for the Prevention and Cure of Consumption and Other Forms of Tuberculosis, which was mercifully abbreviated to NAPT. The NAPT was a charity set up in 1898, 16 years after Koch's discovery, with a challenge from the Prince of Wales ringing in their ears. If preventable, why not prevented? So the poster is public health propaganda. A slim, fashionable young woman crests a hill, faces the sun, and breathes in ever fresher air. Her path leads away from the polluted darkness of a smoky urban industrial landscape, which could well have been Leeds. The sunlit uplands reflect a general desire for open air and sunshine. In the first decade of the 20th century, there were major anxieties around what became known as national efficiency. The nation and empire were widely thought to be at risk because so many people, particularly so many children, were unhealthy due to industrial urbanization. High rates of disease and disability had been found in potential recruits to the Boer War, and there was a strong feeling that something must be done about the health of the nation, particularly its children. We also had the eugenics movement, which, as you will have noticed, has never gone away. If you want to read about eugenics, there's a nice book on the shelves of the Leeds Library by Adam Rutherford, 2022. It's called Control. Tuberculosis presented a double challenge to the eugenicists. Firstly, how to enhance the national stock by improving the upbringing and environment of tuberculous seedlings to prevent them establishing disease in the population. And secondly, for those who still believe there was an inherited susceptibility to TB, there was possibly the prospect of reducing or even preventing the capacity of the tuberculous families to have any more children. So the lad in the middle is Charles Falkingham, who the Yorkshire Evening News reported had gone missing from his home in East Leeds in March 1914. The report states that Charles used to be an inmate of the Gateforth sanatorium. I'm showing Charles's image for 2 reasons. Firstly, because he'd been a pupil at one of the first ever preventoria in the country, the open-air school for Leeds children at Gateforth near Selby. And secondly, because children's voices are often lost to history. I've selected some headings to help us to get to the heart of this research. I've divided our 63 years into 3 equal chunks of time. These 21-year periods are divided by 2 major transitions. 1918-1919, the end of the First War, and the flu pandemic. 39-40, the beginning of the Second War, and the preparations for the new welfare state, which continued apace throughout the war. At the beginning of our period, charities were at the forefront of the fight against TB during the first 2 decades. We should remind ourselves that in those days, charities were often much more enmeshed with the state, both local and nationally, than they are nowadays. The interwar years were a time of economic hardship, and many here will be familiar with the biographies of Richard Hoggart and Keith Waterhouse, 2 of the city's more famous offspring. As it happens, both of their childhoods were affected by TB. After his mother's death from consumption, therefore almost certainly tuberculosis, Hoggart was an orphan and moved to live in respectable poverty with his paternal grandmother in Hunslet on the south side of the city, who, as members of this audience will tell you, was still a separate township. Hoggart's account of the continuing support from the Hunslet Board of Guardians showed a benign system working to support him. Hoggett remembered visits by Miss Chubb from the board, who asked specific and direct questions concerning his physical welfare, such as, "What is the boy having for breakfast this morning?" and "Has he had a cold last month?" Keith Waterhouse, another well-known graduate of the streets of Leeds, was 11 years younger than Hoggett, but he started his life in Hunslet. After his family's home was demolished in a sort of interesting echo of a more recent science fiction writing for a road widening scheme, they were rehoused to Middleton, a newly built housing estate, one of the ambitious interwar housing schemes for which Leeds was well known. Tuberculosis affected his near neighbours. He writes, "Upstairs from us was an enormous family of tuberculosis sufferers who one by one were carried off to the sanatorium with the regularity of the Brontes. Galloping consumption, as it was known, was common in our neighbourhood." In the final 2 decades, the British welfare state emerged fully, and we got specific drugs against tuberculosis. And as we shall see, the Hollies became a bit of an orphaned institution. The children of the Hollies did make an occasional appearance in the local press. Sorry about the poor quality of this image. It's a photo to amuse the readership of the Leeds Mercury on a slow news day in August 1930. But I wonder, aren't these children very young to be living away from home? Please don't worry about the details of the graph on the left. It shows the trend in mortality from TB in Leeds and in England and Wales from 1890 to 1938. It's very clear that deaths from TB in our city and the country were in a constant decline, except for a big blip around the First World War. Dr. J. Johnston Jervis, known to his colleagues as JJ, was born in the year of Koch's discovery. He was an Edinburgh graduate and a fine example, among many others, of excellent Scottish medical exports to England. He moved to Leeds in 1915 as a medical assistant in public health and part-time tuberculosis officer. Just 4 years later, in 1919, he became medical officer of health for the city, and soon afterwards was appointed professor of public health at the university. He's best known for his tireless campaigns to improve air quality and housing. In his valedictory annual report in 1946, he made the bold statement that the decline in TB was the greatest achievement in preventive medicine that century. It was an extraordinary assertion. TB was already declining in the late 19th century, and there were other huge achievements, for example, in infant and maternal mortality in the 20th century, which were arguably more significant. However, Jervis was of the generation who had witnessed the ravages of TB. He had seen its alarming resurgence around the First War and would continue to prioritise TB services even when the numbers continued to decline. In his valedictory annual report, he'd made the bold statement about the TB decline, and I'm now about to advance the slide with some trepidation. Yes. So very briefly, this slide illustrates the basics of TB in children. Our understanding now is much the same as it was 100 years ago. Doctors then knew about modes of transmission, and in the early 20th century, some children were infected via tuberculous milk, but about 90% got it through their respiratory systems. The primary complex is about as far as the disease gets in most children, whose defences wall it off nicely. But if TB does take hold in children, it often spreads rapidly and is a more widespread disease than in adults. 1899 saw the Leeds Tuberculosis Association founded as the local charitable equivalent of the NAPT, to which it was affiliated. Sir James Kitson, who would later become Lord Airedale, was the chairman. Of 12 honorary positions, there were 7 doctors and 5 magistrates, 3 of whom were aldermen. The committee of 30 were all men. The 2 honorary secretaries, the people who I think did most of the work, were both doctors, Professor Trevelyan and Dr. H. Carl Woodcock, the chief tuberculosis officer. Woodcock was a pioneer, somebody who was very hardworking, but also very verbose. And he'd already established a tiny sanatorium in a farmhouse in Farnley in Wharfdale as part of the Hazlitt and Holbeck Sanitary Association. Woodcock joined the National Committee of the NAPT in 1912, the same year as he published his book, The Doctor and the People. In one paragraph, Woodcock's words betrayed a victim-blaming attitude to people living with and dying of tuberculosis. He said, "The beautiful and the rich receive it from the unbeautiful poor." Anecdotes about his medical work with the urban poor are woven throughout his book, and they seem to show more sympathy for his patients' plight than the above quotation might suggest. There was a clear division of labour between tuberculosis associations, with the local branches initially concerning themselves much more with cure, and the national body concentrating on education and political influence. The LTA moved swiftly. By 1902, they were converting the country house at Gateforth, near Selby, into a sanatorium. Within 8 years, that institution had 35 beds. They also opened a 45-bed tuberculosis hospital at Armley House, another converted mansion. Converted mansions seem to appear quite often in this story. But there was a Ladies' Samaritan Committee, consisting mainly of the wives of the men who ran the LTA, and they started meeting in 1901. Their first aim was to assist those consumptives who have their names in the books of the Leeds Tuberculosis Association. Their objectives were to obtain employment for those discharged from the sanatorium, provide tickets for convalescent homes, and to collect and distribute funds to assist those patients in temporary money difficulties. Children weren't specifically mentioned in their aims, but they were very much involved with family visiting to see what necessary precautions against infection were being carried out. Home visits were described by the lady visitors quite often as distressing. A lack of resources to meet the level of need found on those home visits was a major factor in the decision of the Ladies' Samaritan Committee to disband after only 2 years. However, Mrs. Newsom of the Charity Organisation Society came to the first meeting of a revived and revised Ladies' Samaritan Committee in 1907. Part of the role of the Charity Organisation Society was to make links between charities and reduce overlaps between benevolent organisations. By 1909, the Ladies' Samaritan Committee members were each taking an interest in one geographical area of the city, but most of the home visits were by then done by a nurse. Significantly, they were able to start looking upstream at the more preventative aspects of their work. The Tuberculosis Association report for 1909 noted that the good work of the sanatorium was often undermined when patients returned home due to the sheer want of food. Internationally, 1907 was a pivotal year for children's TB. Von Perke, I hope I'm pronouncing it right, he was Austrian, was regarded as the father of modern immunology. He showed that it was possible to detect, using a simple skin test, which children had been infected with TB. He presented more results to the International TB Congress in Washington, D.C. in 1908, after which the concept of the pre-tuberculous child rapidly became popular. Dr. Woodcock and Professor Trevelyan from Leeds were at that conference in Washington. The new skin test showed which children had been infected. Post-mortem studies of children who died from other causes had showed a high rate of latent infection. It was reasonable to extrapolate from these findings that many poor children were reservoirs of TB, and if only their immune systems could be boosted with food, fresh air and sunshine, they would be much less likely to develop TB disease later and would therefore not be a threat to public health. Pre-tuberculosis was an extremely useful clinical category, but very difficult to define and always controversial. James Kerr was in charge of the pioneering school health service in Bradford at the time, and his rather vague description was typical of many. This diagnosis coincided with the beginnings of the National School Health Service. The label pre-tuberculous enabled school doctors to help at least some of the thousands of poor, malnourished children they saw in the elementary schools every day. It looks like the open-air school at Gateforth could have been, as claimed by the local press, the first residential school of its type in the country. The journalists from the Skyrack Courier indulged their literary aspirations by quoting Shakespeare's Hamlet in an enthusiastic report. Given the Yorkshire climate, it's worth noting that the school was only open in the summer months. Sorry, the warmer months. All children stayed for one term. If you would like to see what an open-air school looked like, you can go to the British Film Institute online and search for the story of John McNeill. It's possibly the first ever health education movie produced in this country. And if we wanted to, we could watch it after the meeting this evening. The employment of a nurse came at a time when the Ladies' Samaritan Committee were overwhelmed by the numbers of economically poor tuberculous households they were trying to visit. Using the resident children, suitably educated about good hygiene and diet, as agents for change at home was a common theme in similar schools. And now then, I think I don't want that slide. I think I want this one. Yes, the First World War and the flu pandemic were devastating, but the advent of a national tuberculosis service was a great achievement for the NAPT. It also led to a rapid switch in the work of the national and local TB charities. No longer would the LTA manage medical services, they were to focus on social support. Yeah, I think you're right. Records of the Leeds Tuberculosis Association record a couple of ill-tempered standoffs between them and the City Council about who got to control what. But these were resolved once the LTA had to accept that their future role would be restricted to charitable support for hard-up families with TB. However, members of the LTA lobbied hard for a replacement for the school at Gateforth, which closed in 1918. The Hollies was gifted to the city in 1921. I told the tragic background of that bequest during my previous talk here. It eventually opened as an open-air school for pre-tuberculous children, aka a preventorium, and a sanatorium for children with active TB who didn't need round-the-clock nursing care. The more poorly children with TB were admitted to Killingbeck. Some of you will have known of the Dr. Fernandez affair, which features in Michael Meadowcroft's chapter in Derek Fraser's History of Modern Leeds. Dr. Zachariah Peter Fernandez graduated from Leeds Medical School and held the role of acting chief tuberculosis officer for the city in 1925, the year the Hollies opened. When the substantive post was advertised, Dr. Fernandez was unsuccessful in getting the job. He was a popular figure, particularly with ex-servicemen with TB, and there was a huge concern, backed by the local press, that his non-appointment was due to racialism because he came from India. The council, who ran the TB service, denied this allegation, of course. Dr. Fernandez's annual report for 1925 shows a huge discrepancy between the numbers of children diagnosed with TB in the year he was in charge and the number in preceding and following years. In 1925, there's a temporary, almost four-fold increase in the number of children diagnosed. The controversy rumbled on. He wasn't appointed at the next round of interviews either. Eventually, Leeds called in the Ministry of Health for an independent review. Dr. Fernandez's clinical judgment was called into question by this external inquiry. He resigned his post and went on to be a very successful local GP. He was a Labour councillor for Richmond Hill for many years and took a strong interest in mental health services. I think Dr. Fernandez was a hard-working, kind and generous man. I also think he overinterpreted children's chest x-rays to make TB diagnoses. It's also possible that his colleagues underdiagnosed TB in children to a certain extent, but I do think that he was a bit liberal. As it happens, I worked in rural Kenya in the early 1980s and therefore have lived experience of the challenges of trying to diagnose TB in poor malnourished children, so I can empathise with Dr. Fernandez. In 1925, there were significant financial benefits to poor families if someone had a diagnosis of TB. However, there were also significant disadvantages. You were, for example, much less likely to get certain jobs or life insurance, or be allowed to emigrate to one of the colonies if you had ever had TB. It's my fault that these graphs are slightly out of order. No. So this slide shows some graphs, but please don't worry. It's the trends we need to look at. These graphs encapsulate the change in the clientele at the Hollies from 1925 to 1938. Here we see that the children diagnosed with TB, the top line, quite a few who were probably diagnosed by Dr. Fernandez, and only a couple at the beginning had pre-tuberculosis. And gradually, as time went on, the number of children with TB went down and the number of children with pre-tuberculosis went up. So it became less of a sanatorium, more of a preventorium. As the numbers admitted reduced, the proportion of younger children increased. Given that the number of beds didn't change, then it was clear that children, and that includes very young children, could also stay for longer. Now, it could be argued that a longer stay is good. The more food, the more sunshine, the more fresh air you get, the better. But we might also argue that it's not good for children to be away from their families. Most children stayed for about 6 months, many for up to a year, a few for as much as 3 years. There were certainly some children in the Hollies register who were eventually discharged to foster or adoptive homes. I'm just going to try and find a slide which, there it is. This is an extra slide, but because I've got more time, I can talk about it, which is nice. So in all preventoria, close attention was paid to children's weights, and weight gain was probably the easiest measure of success. Certainly a failure to gain weight with all that good food raised the question of whether the diagnosis was right. These days, of course, we have sophisticated growth charts based on child population norms. In the Hollies register, ages on admission were by year, and weights were measured in quarter-pound intervals. So there are plenty of baked-in inaccuracies, but the inaccuracies should be spread across the data set. They shouldn't be sort of particularly affecting one group or another. So across all three age groups, girls gained more weight than boys. And these differences are, you'll be delighted to know, statistically significant. So let's have some suggestions from the audience, which I will relay to those on Zoom, about why might girls be gaining more weight than boys across all three age groups when admitted to somewhere where they get more food. Alan says.
I would guess that in poor families, boys got preference when it came to doling out the food.
Okay, so Alan says in poor families, boys get preference when it comes to doling out the food. Okay, any other suggestions?
Is it the time of pubescence? You know, they don't
Yeah.
the hormone changes.
Yeah, so another suggestion is, what about puberty? We know that girls go into puberty a couple of years younger than boys. So certainly in that third age group, I think that's a contribution to the, yeah.
Are they wearing girls' clothed and boys not?
Well, it shouldn't affect weight gain, should it? Unless they put the clothes, yeah. So absolute weights, that would be a factor. Yeah. There's one more suggestion which might be forthcoming. You were supposed to rest when you went to the preventoria. But of course, generally speaking, in the playground, the boys generally culturally going to be running around playing football, and maybe the girls are going to be sitting looking at flowers. I don't know. That's a terribly prejudicial thing to say, isn't it?
Girls be doing.
Yeah, it might be doing needlework. Yeah. I think of all those three suggestions, that boys are more active, that boys are fed better at home, and it may be something to do with puberty. I think it's Alan's suggestion gets my vote, I think, because I think girls came in more malnourished than boys. I think that's the most likely explanation. So there you go. Now let's see what's going to be the next slide. I think I have to go back to where I was, to Dr. Tattersall. Let's see if we can find Dr. Tattersall. Going. Yes. Norman Tattersall got the substantive post of Chief Tuberculosis Officer for Leeds after the Fernandez affair, and he had a distinguished career as well. When he left Leeds, he took over TB control for all of Wales and ended up as an honorary physician to King George VI. Not only did he take a close personal interest in the Hollies, he became something of a national expert on preventoria. My reading of his reports is that he somehow managed to juggle not one but two dilemmas, which reflected the controversies of the interwar period. Firstly, the revolution that was pre-tuberculosis depended on the idea that a positive skin test gave doctors the necessary clue as to who had been infected. Tattersall wasn't the only one questioning this. He notes in 1932 that perhaps it's the infected children with such poor immunity who cannot raise a positive skin test that people should really worry about. He was right. And that called into question whether they were admitting the right children to places like the Hollies in the first place. But around the same time, an American research group reported on a painstaking decade-long longitudinal study of children in a preventorium, and they concluded that pre-tuberculous children were no more of a threat to public health than any other child. They would fare just as well if they stayed at home. The Americans closed down their research preventorium as a result of their research. Tattersall was well aware of these findings and must have had his doubts about the rationale for the Hollies. However, in all his annual reports, he continued to extol its benefits. But he chooses his words carefully in 1933. It's all about protecting the children from adults who had open TB at home, no longer protecting the population from the threat of pre-tuberculous children. J.J. Jervis, Tattersall's boss, also continued to maintain an enthusiastic interest in the Hollies. There's some evidence from the mid-30s that some institutions for children with TB in Yorkshire were having difficulty filling their beds. The doctor in charge of the private sanatorium at Eastby, near Skipton, was in correspondence with the Board of Education about changing its use, initially to be a school for what were then called mentally defective children, and later she suggested a residential open-air school for a wider range of delicate children. The education authorities for the West Riding did repurpose the Mitchell Memorial Home in Rawdon to take delicate rather than only tuberculous children. More generally speaking, it's also very difficult to close an institution that has become part of the charitable scene, who local worthies can patronise, and everyone can feel better because they're doing something for the children. The last 2 decades of my story were decades of disruption for the children of the Hollies due to the Second War and an unfortunate unintended consequence of the new welfare state. The children, along with those from the sanatorium at Killingbeck, were evacuated to Eastby near Skipton at the outbreak of war in 1939. So the war brought a use for the sanatorium at Eastby. J.J. Jervis continued his interest and personally oversaw the evacuation. There's a fascinating bit of correspondence between the head teacher of the group of children who moved to Eastby and J.J. The local air raid warden had advised that, in event of a raid, it would be better for the children to shelter in the big house at Eastby, whereas Miss Morgan thought it would be safer for them to hide in the woods. She appealed to Dr. Jervis, who agreed with her. The children moved again in 1940 to Villa 8 at Meanwood Park Hospital, and it wasn't until 1948 that the institution returned to the Hollies. Rates of tuberculosis continued to decline, but the new drugs were transformative for both adults and children. BCG immunisation was introduced to prevent school children developing TB as young adults. And by the mid-50s, more children were being admitted to the Hollies for social reasons than for any link with tuberculosis. In the late 50s, a significant number of sibling groups were admitted, often more than once. The unfortunate unintended consequence of the turmoil surrounding the birth of the NHS was, in my view, that the Hollies ended up being managed by a hospital board for 6 years, because by this time, the Hollies was basically a children's home. And at the same time, radical improvements aimed at improving the emotional and mental welfare of resident children were being made to the local authority children's homes in Leeds. But I don't think this happened to the same extent at the Hollies. There had been a growing realisation nationally, well before the groundbreaking work on attachment by Bowlby in the late 50s, that young children needed a consistent parent figure in order to develop secure relationships. The case for enlightened institutions for children, if institutions were necessary at all, was made in Oliver Untwisted, a popular fictionalized booklet which was first published in 1929 and was in its 5th reprint by 1937. Matron is the hero of the tale as she confronts the old ways of the poor law institutions and fights for the rights of every child, however disruptive and wayward, so that each child should be listened to, understood and loved. My strong impression is that during its last decade as a preventorium, the Hollies became a rather neglected institution, like some of the children who stayed there. It was removed from the care of its birth parents, the City Council, when the NHS started in 1948, And by the time it was handed back in 1954, people weren't quite sure what to do with it. One contemporary doctor described it as a hostel for delicate children, but the style of care was more medical. It had a matron and nursing assistants. One of my interviewees was a man in his 70s who was admitted to the Hollies at the age of 3, when his mother was diagnosed with TB, his father was ill with cancer, and the extended family wouldn't take the boy in. It wasn't social services who were responsible for his admission. It was the health service, but it was voluntary. There was nothing compulsory about it. His account, which you can read, was rather bleak. Some other people I've spoken to have been more positive. Over these 63 years, we've seen many transitions in the response of the city to children at risk of TB. The Leeds Tuberculosis Association were the pioneers, opening one of the first residential schools in 1911. Home visiting was done by the Ladies' Samaritan Committee, who then employed a nurse. Soon after the end of the First War, the state at local and national levels took over, and we see medical, educational and social services for children emerge as more distinct entities. The Hollies sat right in the middle of the Venn diagram of statutory services for children. My contention is that the spectre of TB that haunted physicians for the first half of the 20th century led to a continuation of residential care for children at risk of TB for about 20 years longer than was actually necessary. Thank you.
Thank you very much, David. We're open to questions from the floor, and also there may be questions for those who are listening and watching online.
So, in skin tests, is that what I might have had at school in the 70s with the 6 needles?
Yeah. So the question was the skin test like we had at school with the 6 needles? Yes, it was. I mean, it wasn't 6 needles, but it was basically the same protein injected under the skin. So it hasn't changed much.
How nice that Leeds leads for once, which it used to. They said that. How generally did Leeds compare, say, with Manchester, Birmingham, Liverpool, in terms of the percentage of the population of children who had TB?
It's a very interesting. So the question was, how do we in Leeds compare with other provincial cities in the percentage of children with TB? Sheffield is interesting. So Leeds would have similar data to some of the other cities that you mentioned, but Sheffield had much higher rates, and I think they were diagnosing more children, a bit like Dr. Fernandez was, and I think it was to the benefit of seemed to be for the benefit of the children, but I can't prove it. There was a lot of comparison in how many beds there were, and Leeds physicians were always complaining that we didn't have enough beds, and that was true throughout most of this until the 50s, I think. So the new Killingbeck, when was that built? Anyway, so we were underbedded compared to most comparator cities for most of this time.
Thank you.
Question in the chat. Were Jewish children accepted from the Hollies? And if so, how was their religious diet catered for?
It's a good question. So the question was, were Jewish children accepted at Hollies? And if so, was their diet catered for? In the columns in the register, it gives religion. And there are very, very few Jewish children admitted to the Hollies compared to the number of Jewish children who are around. I've spoken to one person who was from that background, who had a particularly difficult time in 1948. She attributes it partly to her background. So I think they were underrepresented, and a sample of one would suggest that their treatment wasn't particularly good.
So the propaganda, or was it just propaganda of fresh air and the stuff, or was it just that they were taking out certain infections area, or obviously the big breakthrough was the drugs, but how did sunlight and things affect it? Was it just better diet?
Yeah.
Or was it just a bit of a myth?
Yeah, so the question was, is fresh air and sunshine a myth, or was it just that people were taken out of dreadful situations? Now, of course, 1870, there's the sanatorium movement generally was getting going, and lots of really rich people were going off to places like Davos to have the cure. And I think the jury's a bit out about that. I mean, it's certainly true that you're more likely to get TB as a child, more likely to contract it in an underventilated, overcrowded household with an adult with open TB. It's very difficult to avoid it. So I think for most of the children we're talking about who were living in what could broadly be described as slum conditions, it was a nice place to go and get a bit of fresh air.
Cures.
Yeah, I think so. But yeah, I mean, I think I got TB because I'd been slaving away in the NHS for a couple of years, but I was also exposed to the bug. Probably, I don't think it had been in me from childhood. So yeah, it's a lot to do with boosting your immunity. So it's not a complete myth.
Obviously, that was people were taken away and put in there. But that graph you showed, there's a very big trend line coming down. What were the other factors in the general population that weren't taking this place? The living conditions getting better.
Yeah, Clean Air Acts, better housing, better workplaces, all those things really, really important.
I don't know whether this work. What happened in 1958, please?
Yeah, so when it stopped being a children's home, it was basically a children's home in 1960. I'm not quite sure of the sequence, but the City Council have used it as an old people's home. They have used it as a place for women at risk. It's now privately owned, and David Cooper, who's the owner, has shown me around and is acknowledged in the acknowledgements. Yeah.
I should add, if you looked in the Yorkshire Post Property Supplement only a fortnight ago, it was being advertised having been converted into 4 luxury flats. So if you'd like to go and sit in Woodland.
Yeah, you're more up to date than I am, but yes, it's a grand building.
Can I ask just how did children with a rural background who contract TB from untreated milk, how did they fit into this story?
I haven't researched children from a rural background. I mean, the children who got TB from milk were city children. A lot of the milk coming into the city was untreated, and there are pages and pages in the MOH's report every year about milk inspections and closing down farms, and they were really trying hard to change it before. They were really working hard on it. So the city kids were just as much at risk as them. But I can't speak to the approach for children living in rural areas.
I was just wondering about the international aspect. Was this approach of fresh air, etc., widely distributed across certainly Europe and the
Yes.
States. I remember once being in a village in Portugal, which had a number of sanatoria or preventoria.
Yeah.
It's high up
Yeah.
in the hills.
So the question was about the international dimension. Was this trend? And yes, it was so the whole of North America, the whole of Western Europe, and certainly the British colonies were, and both the Germans and the French had early systems developed, and probably don't have time to go in. The French had a Granger system whereby children at risk like this would just be fostered out to a farm, and they might never come home, but they were often there for a decade, helping to work on the farm, and everybody was reasonably happy, so it seemed. And for a couple of years, the Leeds Tuberculosis Association was saying, let's try the Granger system, and they got as far as inspecting 1 or 2 cottages out in the countryside. They never actually took off.
Questions? Thank you very much, David, for your interesting talk and sharing the fruits of your research. I do hope that you'll be able to present the fruits of your research for publication
Yes.
to our
Yeah, I'm already.